Hello friends, myself Dr. Vikas Kaushik, oral and maxillofacial surgeon, Swastik Dental Academy, Gurugram. So today we are going to discuss about horizontal and vertical mattress suture technique both. First of all, we'll discuss the technique, then we will discuss its indications, then we will discuss advantages and disadvantages. So let's start with this video. First, we will understand the technique of horizontal mattress technique. So, place the first pass of the needle as you would a simple interrupted suture, but insert the needle into the skin a bit farther from the wound edge. You have to push the needle through each wound edges separately, as you can see in this video. After making an exit point, you have to reverse the direction of the needle in the needle holder. Now place the second pass beginning on the same side of the laceration and inserting the needle 0.5 cm next to the exit site of first pass. Second pass should be identical but parallel to first pass. Pull gently on the suture ends to achieve wound approximation and epidermal eversion. Tie the suture closed. This stitch is placed in a far near order of bites. So first of all we will place far loop, as you can see in this video. Far loop enters and exits the skin surface at a 90-degree angle some 4 to 8 mm from the wound margin. This loop passes relatively deep into the dermis. After placing this far loop, we will place near loop. This loop enters and exits the skin surface 1 to 2 mm from the wound margin and traversing the wound at 1 mm depth. Depth of the bite is more in far loop as compared to near loop. After passing the needle through both loops, we will tie the suture. To get or to achieve proper wound approximation and tissue eversion. Indication for horizontal mattress suture techniques are large distance between the tissues, implants, bone grafts, and closure of extraction socket. Advantages are that it provides good hemostasis and it causes less prominent scarring. Disadvantages are: number one, it can cause strangulation and skin necrosis if it is tied too tightly. Second, it leaves a gap between the tissues. And third one, that it is difficult to remove. Vertical mattress suture technique is basically a far and a near technique. Its main indication is that where the wound edges tend to evert. Greater closure strength and better distribution of tension across the wound edges are the main advantages of vertical mattress suture technique. Disadvantages are: number one, it causes relatively high propensity to dig into the skin, and number two, it causes prominent stitch mark scars on the skin. So guys, अगर वीडियो पसंद आई हो तो प्लीज़ लाइक करें, कमेंट करें, and if you are new to my YouTube channel, so please subscribe it. So guys, see you in the next video.